Understanding the distinction between body dysmorphic disorder and anorexia nervosa is crucial for anyone preparing for a licensing exam in the mental health field. These two conditions are often confused because they both involve concerns about body image, but their underlying features and diagnostic criteria are quite different. Throughout this section, we will explore the specific symptoms that set them apart, drawing on real-life client examples to illustrate key differences. By recognizing what to look for in your practice, you'll be better equipped to make accurate assessments and provide appropriate support. This foundational knowledge not only helps you pass your exam, but also ensures you deliver effective care to those who need it. Body dysmorphic disorder, commonly referred to as BDD, centers on an intense focus on a particular body part or feature that the individual perceives as flawed. According to the DSM criteria, this involves a persistent preoccupation with the perceived defect, often leading to repetitive behaviors such as mirror checking or seeking reassurance. The distress caused by these thoughts and actions can significantly interfere with daily functioning. Although the DSM does not specify an exact duration for symptoms, they typically persist for months or even longer. It's important to note that BDD is not simply about concerns related to weight or body fat. The fixation can involve any aspect of appearance. Anorexia nervosa is defined by specific criteria outlined in the DSM. Individuals with this disorder restrict their food intake, resulting in significantly low body weight. They also experience an intense fear of gaining weight or becoming fat, even when underweight. The diagnosis requires that these behaviors persist for at least 3 months. There are 2 recognized subtypes: the restricting type, where weight loss is achieved primarily through dieting and fasting, and the binge-eating, purging type, which involves episodes of binge eating or purging. Severity is determined by the individual's body mass index, or BMI. It's important to distinguish anorexia nervosa from body dysmorphic disorder, as the focus in anorexia is on body weight and shape, rather than perceived flaws in appearance. Let's take a moment to highlight the similarities between these disorders. Both conditions disrupt how individuals perceive their bodies, often causing significant emotional distress. This distress can lead to repetitive behaviors, such as frequently checking mirrors or fixating on food intake. Common psychological symptoms include anxiety, depression, and a tendency toward social withdrawal. These disorders frequently begin during adolescence and can be challenging to manage effectively. While their impact on mental health overlaps, it's important to note that the physical health risks associated with each disorder are distinct. Body dysmorphic disorder, or BDD, typically focuses on 1 or 2 specific body features that the person perceives as flawed. In contrast, anorexia nervosa centers on concerns about overall weight and body shape. People with BDD often engage in behaviors like hiding perceived imperfections or seeking cosmetic procedures. Those with anorexia, however, are primarily driven by food restriction and a relentless pursuit of weight loss. The physical health risks associated with anorexia are usually more severe and immediate, given the impact of being underweight. Importantly, BDD can affect individuals regardless of their weight, while anorexia is defined by being underweight. There are also differences in gender patterns between the 2 conditions. Alex is a talented software engineer, but his thoughts are consumed by concerns about his nose. He finds himself repeatedly checking his reflection in mirrors, searching for flaws that others might not even notice. Social gatherings become stressful, leading him to withdraw from friends and colleagues. Alex has even gone so far as to consult surgeons about rhinoplasty, hoping for a solution. His preoccupation begins to affect both his relationships and his performance at work. Despite recognizing that his worries may be excessive, Alex feels powerless to control them. Alex's concerns center exclusively on the appearance of his nose, rather than his body weight or shape. His repetitive behaviors, such as mirror checking, applying makeup, and seeking consultations with surgeons, are all aimed at concealing or altering this specific feature. Unlike individuals with anorexia nervosa, Alex does not exhibit a preoccupation with being overweight, nor is he underweight. The distress he experiences is not related to fears of gaining fat. These characteristics align with body dysmorphic disorder, or BDD, rather than anorexia nervosa. For exam purposes, the correct diagnosis in Alex's case would be BDD. Emily is a college student struggling with severe food restriction. Despite being significantly underweight, she remains deeply afraid of gaining even a single pound. Her daily routine revolves around counting calories and engaging in hours of exercise, often at the expense of social activities like eating with friends. These behaviors have taken a serious toll on her health. She feels constantly exhausted, has difficulty focusing, and has missed several menstrual cycles. Yet, Emily continues to perceive herself as overweight. Her sense of self-worth is closely linked to losing more weight, illustrating the powerful grip of her disordered eating patterns. Emily displays several hallmark features of anorexia nervosa. She restricts her food intake, maintains a low body weight, and has an intense fear of gaining weight. Unlike body dysmorphic disorder, her actions are focused on overall weight loss rather than preoccupation with a specific perceived physical flaw. The health issues she experiences, such as missed menstrual periods, are direct consequences of malnutrition. These symptoms align closely with the diagnostic criteria for anorexia nervosa, making it the most accurate diagnosis in her case. It's important to recognize the differences between body dysmorphic disorder and anorexia nervosa, even though both affect how people perceive their bodies. Body dysmorphic disorder centers on a preoccupation with specific physical features, while anorexia nervosa is primarily concerned with weight and overall body shape. Individuals with anorexia often display significantly low body weight and an intense fear of gaining weight or becoming fat. In contrast, those with BDD are usually fixated on a particular body part they believe is flawed. Accurate diagnosis is crucial, as it guides the most effective treatment approach for each condition.